Hi everyone, I'm Amy from the marketing team, and today we're here with a special guest. This is James Thompson. James, thank you for being here today.
Well, thank you for having me.
So he's going to tell us a little bit about his job and his connections with Atonix. First, for a little overview, what's your job title? What's your responsibilities?
My job title is Healthcare Affairs Manager, or HCAM for short, and I work with Boehringer Ingelheim, Canada. Boehringer's a unique kind of company. It's a privately owned global pharmaceutical company. We're here at Invest Ottawa, so it's important to mention that Boehringer was once a startup company about 130 years ago by Albert Boehringer, and still today it's family run, so that's what makes it unique. My overall responsibility is to engage in partnerships with multiple stakeholders across the healthcare ecosystem and to really drive transformative change in the healthcare system, leading to better patient outcomes.
Definitely. And how did you and Boehringer discover Atonix?
Well, it was actually through Invest Ottawa, through my network, one of my contacts at Invest Ottawa. They were aware of the type of work that we were doing in system change and in helping hospitals and regional health authorities with just changing the way they do things to improve efficiencies and to deliver better care. And so he made the connection, and I got to tell you, in the first couple of minutes in meeting with Michel and understanding why he developed, founded Atonix and is the CEO of Atonix, I really thought that there was a good fit, and there was something there for us to continue the discussion.
Yeah, definitely. And on that same topic, what inspired you and Boehringer to partner with Atonix?
Well, I think there are really four reasons. The first is that we did an initial pilot. It was quite small, just with a handful of patients. And the anecdotal feedback that came from patients and from providers was unique. They really, really liked it. It was easy to use. It wasn't, this cumbersome application. And it really addressed some of the core issues with delivering coordinated care in the home. And that's really a fundamental lack of inclusivity, where it's difficult for the left hand to know what the right hand is doing.
Yeah.
So I saw a really good fit there. Number two, it's an amazing technology because it really truly defines patient-centered care. It brings care from the outside right into the patient's home, and I think that's one thing that makes it really unique. The other thing is that it focuses on the real-life patient. So Atonix, A Touch Away, wasn't designed in a boardroom with technologists or executives to try to solve one issue in the healthcare system, like to help with reduce the burden of a disease on a hospital system, for example. It was really designed with the patient in mind, and the patient with 4 or more chronic conditions, they don't need one solution for one chronic condition and another solution for another. So Atonix really captured the true needs of the patient and the actual patient, which is multi-comorbid issues.
Yeah.
The fourth thing is that we need, as a healthcare system and as a country, we need to innovate in this space. Home care is clearly where we need to find innovative solutions by coming together in these types of partnerships and using tools like Atonix to address the needs of those patients to ensure that our healthcare system is going to be sustainable.
Yeah, definitely. And how do you see A Touch Away helping chronic patients at their homes?
Well, I'm stealing this from someone's. I can't take credit for it, but one analogy that I heard not too long ago was if care coordinators and families are caring for someone in their home. That game when you're a kid, you have the can and you tie a piece of string and there's another can across the park and you talk into it and you can hear the other person saying. So if the care coordinators and physicians, healthcare professionals, allied health, you name it, and family, if they all have a can, well, Atonix is the string. And when somebody said that to me, and I chuckled because it's true. Coordinated care on its own, it's very complicated, especially for patients with multiple conditions. When in a paper-based type of environment, it's as I mentioned before, it's really difficult for the left hand to know what the right hand is doing, and to really engage the patient in the ongoing management of their care. So I see the impact in helping chronic condition patients at home is that we're moving from a coordinated care model to more of a connected care model, and patients feel more engaged, they feel more empowered, and they kind of feel like the CEO of their own state of affairs. And I think that's really important.
Yeah, of course. And do you see the opportunity through partnership to help people across Canada or in North America using a Touchaway?
Absolutely. I think the only way that we can really advance any system change is by looking at partnerships and non-traditional partnerships as well. The healthcare system is evolving at such a rapid pace. The needs are very high. Sustainability is a major key area to focus on.
Definitely.
And I think if you can find the right partners to come together, you can really do what William Charnitsky has said is to make what great looks like. William Charnitsky, the Office of Chief Health Innovation Strategist of Ontario. To make what great looks like, I think you need strengths from a variety of partners, whether it's from industry or academia or those care coordinators on the ground who are really providing the type of feedback to make the solutions happen from the ground up, the grassroots. So I definitely think partnerships play a major role in making this happen.
For sure. And what do you see for the future of a Touchaway?
Well, I think short term, we have our evaluation that's being supported by our partnership, and that's inclusive of the Office of Chief Health Innovation Strategist with the Health Technology Fund. So that evaluation is going to be wrapping up at some point this year. I think anecdotally, we've had enough feedback from a few pilots that we've run, plus the evaluation, this is a very good tool for patients and care coordinators and family alike. So for the multi-chronic condition patient, I think that the need for us is pretty clear. Longer term, I think that there are so many different applications for Atonics. If you look at discharge planning, if you look at patient monitoring. So I kind of think about it in three ways. Like there's the short term, waiting for the evaluation to wrap up.
Yep.
With the very specific metrics that are being looked at and analyzed by the Women's College Hospital. And then number two is longer term. So how do we expand in this area across Ontario or across Canada? But then I think Star Trek. Like if you think about Star Trek and how you would want to be cared for or how a loved one would want to be cared for, I think that's the opportunity. And when you look at all the available sensors and things like that we know, I mean, intuitively it makes sense, right? If a patient's health status deteriorates to a point where they've got to call 911 and go to the hospital, well, that's not a very good experience for the patient. It's a high cost to the hospital. But what if there was a little light up on your dashboard to say that this patient is in need of this, which could be an intervention that could take weeks before allowing the preventable to happen. Yeah,
definitely. And now, James, do you personally use a Touchaway for your family or friends or anybody that you know?
I do, actually. I do. Yeah. I have a family member who is in a long-term care home, and we use a Touchaway to keep in touch with her and for her to have contact to the outside world and with us and with her friends as well. So for us, after I started working with Atonics, I think anybody and everybody, either now or at some point in their life, they're going to be in a situation where Atonics would be perfect for them to do exactly what Michelle said that first meeting when we met 2 years ago, which was to connect patients and families. I think that's going back down to the grassroots. It has so many applications, but yes, I'm using it personally.
That's awesome. Great. Mm-hmm. Well, thank you so much for being here today with us.
Well, thank you for having me.
Of course. And thank you everybody for watching. Hope you have a great day.